Good day, my menopausal friends. Welcome back to my classroom. You are learning so much about how to manage your menopause your way with success. And there's still so much more to teach you. Here's where we are in the course. I started years ago, at the very beginning, teaching you the most basic things you need to know in order to understand anything about menopause. My teaching style is to assume you know nothing. And that's because when it comes to menopause, most women know nothing. I am the first and only person to ever provide an actual education on menopause to women. And if you watch my videos in order, starting with the very first one, I make sure that I address everything. I dispel all the misconceptions, anticipate your questions, and lead you through the education in a way that makes it almost impossible for you to have trouble understanding anything. And I cover all the material in units. And you need everything that preceded each unit in order to benefit from each additional unit. There is just no way to get this education if you don't go about it in an orderly manner. So here we are, devouring a unit on the three big diseases of estrogen deficiency: heart attack, osteoporosis, and Alzheimer's. Currently, we're talking about how to prevent them using estrogen replacement. In video 288, I taught you that you have to take at least a designated minimal dosage of estrogen in order to prevent these three diseases. And in video 289, I taught you that compounded estrogens are too unreliable to use them for preventing these diseases. And in video 290, I taught you that there is no way to use any kind of hormone level testing to determine if you're taking enough estrogen to prevent them. So, what can you do to monitor whether or not you're preventing them? That's what we'll address today. Now, why is this important? Well, it's because all three of these diseases sneak up on you. They are all silent in one way or another, meaning they're already very advanced and you're already pretty doomed once they make their presence known. So this video teaches you what you can do to assess for them, regardless of whether or not you choose to take estrogen replacement or the minimal necessary dosage of estrogen or compounded estrogen. You will not find this in my book, whether you have the first edition or the second edition. This video is an extra. Just because it's not in the book doesn't mean that it's unimportant. It's just that as an author, you have to limit how much you can put in a book. And that's why you should use both my book and these videos to get the education you deserve. To begin, let's acknowledge the fact that it's difficult to know if you're developing any of the three big diseases before it's too late. Heart attacks occur suddenly. Bone fractures from osteoporosis occur from completely non-traumatic incidents. And Alzheimer's doesn't present clinical symptoms until 40% of your brain is gone. So if you can't use hormone level testing to ensure you're taking enough estrogen to prevent these diseases, what can you do? Let's go through each of these diseases one at a time, delineating the sequence of events that cause it and also indicating what you can do to monitor it. When it comes to heart attack, you build up plaque in your coronary arteries slowly over time. Even young women in their 20s and 30s can have some plaque buildup in their arteries. Little by little, year after year, plaque accumulates. You don't usually notice symptoms unless you are unfortunate enough to have significant enough buildup to cause symptoms before you become postmenopausal. But the vast majority of women have nothing to alert them to plaque buildup in their arteries before postmenopause. And that is mostly due to the fact that estrogen helps prevent plaque buildup. But then, when you lose your estrogen at postmenopause, you start packing in the plaque. At the same time, you gain weight and you become less active. So even if you would have had symptoms to alert you to roadblocks in your heart arteries with vigorous activity, the fact that you no longer engage in vigorous activity makes it possible for plaque accumulation without your knowledge. If you do not take estrogen replacement, you accumulate more plaque than you do if you do take estrogen replacement. And if you do not take estrogen replacement, you accumulate plaque faster than you do if you take estrogen replacement. So what if you want to be sure you are preventing plaque buildup? Or what if you want to monitor the extent of your plaque buildup? Or what if you are beyond the 10 years of the estrogen window and in the gap after losing your estrogen, wondering if it's safe for you to start it? You see, all of these are instances in which some kind of monitoring of your heart arteries can give you information that will help you manage your menopause in the best possible way for you. If you have any situation in which you want to know the status of your heart arteries, there are a bunch of tests you can get to determine where things stand. The most basic testing is simple blood tests for your lipids. Back in video 162, I gave you all the details on the different kinds of lipids and their significance. So the first thing you can do is get your blood drawn for a lipid panel. Of course, your lipid studies merely tell you the levels of the various different types of lipids in your blood. They don't tell you anything about any plaque buildup in your arteries directly. But your lipid panel says a lot about what might be happening in your heart arteries. You know, over and over again, I encounter women who are shocked to discover that just after they enter postmenopause, their lipid values start changing. Their cholesterol starts to rise, their LDL starts to rise, their triglycerides start to rise, and their HDL starts to drop. All of these are undesirable changes, and they all reflect what's going on in your heart arteries. They are the very beginning of an indication that absence of estrogen or inadequate estrogen is causing lipid buildup in your arteries. So the first and easiest thing you can do is simply get your lipids checked with a blood test. Beyond that, one of the most efficient ways to actually assess your heart arteries is by getting a stress test. A stress test is just what the name implies. It's a test of your heart under stress. And the stress is usually exercise. There are various kinds of stress testing, varying based on the monitoring device. This involves monitoring your heart in some way while you exercise, be it on a treadmill, an exercise bike, or whatever. And while you exercise, your doctor can monitor your heart with an electrocardiogram, or ECG, to detect any abnormal rhythms, or he can use an echocardiogram, which looks at how your heart muscle and valves work, or he can use a nuclear exercise electrocardiogram. This involves injection of a radioisotope at the peak of your exercise. And if you can't exercise, he can use drugs to dilate your heart arteries in a way similar to what happens with exercise. Actually, here's a cartoon to that effect. It shows a doctor telling a woman who's all hooked up to the ECG machine that she doesn't have to huff and puff on a treadmill because he's developed a different stress test that's faster and more accurate. And you see a nurse holding a bag of spiders over the woman's head, waiting to release them on her. I don't know about you, but if anyone let loose a bag full of spiders on me, I'd have a heart attack. Right on the spot. The stress test would be moot at that point. I just hate spiders. Don't worry, no one really uses spiders for a stress test. All of these monitoring techniques will give you information on the status of your heart arteries and your risk for a heart attack. Alternatively, you can get an assessment of the actual anatomy of your heart and coronary arteries with any of the following: an echocardiogram, a CT scan, an MRI. You can even can find out the degree of blockage in your heart arteries by getting an angiogram or possibly even a cardiac catheterization. And here's another chuckle for you despite the incorrect grammar. They neglected to insert an apostrophe between the N and the S of man's to indicate the possessive. I sure hope everyone working in the cath lab is better at catheterizations than they are at grammar. You see, these are all tests that cardiologists conduct on patients all the time. And I'm a big believer in peace of mind. I always say that you should do whatever it takes to give yourself the peace of mind you need. So if you want proof of the status of your heart arteries, get a cardiac evaluation using some of these tests. You can also do so if you want to determine if you're a candidate for starting HRT. Many women who are outside their 10-year estrogen window get cardiac evaluations to determine if it's safe for them to start estrogen replacement. You can get these tests periodically if you're at high risk of a heart attack. And you can also do so if you want to monitor your progress in decreasing the plaque in your heart arteries. Peace of mind comes from having information that is accurate. The biggest fear is the unknown. So you can use these tests to erase the unknown and thus erase the fear of taking estrogen replacement or the fear of having a heart attack. Any cardiologist can do these tests that can give you the peace of mind you need. And if you discover that you do have a lot of plaque buildup in your heart arteries, you'll know before you have a heart attack. And that may motivate you to do everything you can to lower your risk. So what about osteoporosis? What if you want to know if you're losing bone long before you sustain a fracture? You know the answer to this, don't you? I've taught you this quite emphatically. You get a DEXA bone density test. Of course, you might have to pay for it, but that's okay. It's only about $200 or $300. A fracture will cost you a lot more than that. The guidelines and your insurance probably won't pay for it before you're 65. But if you wait until then, you might have already fractured. Of course, be sure to schedule the consultation with me for the interpretation, because as I've taught you, all the standards for everything in the world of osteoporosis are designed by the disease care industry, which consists of medical doctors like me. But we're really just repairmen. All we know how to do is fix you once you're broken. So the entire system of osteoporosis is designed to let you break. I am the only person who will tell you the absolute truth about your bone density results. And that's not because I know more or because everyone else is lying to you. It's just that they are all following the distorted guidelines that are designed to let you break, and I'm not. I think the whole protocol for osteoporosis diagnosis and treatment is just criminal. And I just don't want you to break. I don't even want you to lose bone or fail to replace bone. So schedule a consultation and let me interpret your bone density test. The fact is that this is just so easy for all women to know if they're losing bone so that they can do whatever it takes to prevent a fracture. But they aren't doing that simply because the guidelines aren't set up that way. So the DEXA bone density test is the tool for monitoring your bone. It's quick, painless, inexpensive, and readily accessible, so use it. Remember, bone loss is something that has no symptoms at all, and you never see a fracture coming. And here's a not so funny cartoon about it. The husband is holding a bunch of bones saying, "I keep finding these all over the house." And his wife responds with, "My doctor says bone loss is normal at my age." You know better than that, right? Okay, moving on to Alzheimer's. This is the most complicated one. As I've taught you in the Alzheimer's unit, there is no clinical test for diagnosing Alzheimer's before it becomes clinically evident. Alzheimer's is a disease that is very slowly progressive. The definitive diagnosis is made at the time of autopsy after someone has died from it. But there is an imaging study called positron emission tomography, or PET, and it can possibly detect Alzheimer's early. But It is very, very expensive and not readily available. The only alternative is a mental status exam, but that's designed to confirm that you do have Alzheimer's, not to rule out the fact that you don't. In other words, it's not technical enough to ensure that you don't have it. When it comes to Alzheimer's, it's better just to do all you can to prevent the disease, because there really is no way to monitor for it. You will not know you have it until it's too late. And I gave you a bunch of videos on how to prevent it. They were videos number 253 all the way through 280. And I've even found a tasteless cartoon on Alzheimer's. This woman says, I told you I don't have Alzheimer's. What I do have is what I call some-timers. Sometimes I remember, and sometimes I don't. Now you know, and don't forget it. So what you have is 3 fatal diseases of estrogen deficiency. You can monitor for heart attack and osteoporosis, but you can't monitor for Alzheimer's. So if your goal is to avoid these 3 diseases with estrogen replacement, be sure to take at least the minimal necessary dosage and take advantage of cardiac testing and the DEXA scan to ensure that you're meeting your goals if you need to. Do not rely on hormone levels. They mean absolutely nothing. What you're learning is that you have to know what it takes to prevent these diseases, and then you have to make sure you're actually doing what it takes to prevent them. And you can use the monitoring techniques regardless of whether or not you take estrogen replacement. Later in this unit, I'll be presenting all the things you can do other than estrogen replacement for preventing the 3 big diseases of estrogen deficiency. So don't fret. You know I'll get to everything. There's just no way I can do it all in one video. And here at Menopause Taylor, no video is a standalone. You can watch a single makeup or hair video and get the whole lesson. But my channel doesn't work that way. Make the commitment to get the whole education and watch all the videos in order, starting with the first one. Otherwise, you're shooting yourself in the foot or the head. Every time a woman poses a question asking, what about those of us who da-da-da-da-da-da-da, I answer with, that would be in video number X. That is, unless it's something that requires a consultation to tailor the information to the individual. Because not everything can be addressed adequately in videos alone. But I do address everything. I'm anal and neurotic that way, to your benefit. Next week, we'll look at the time frames between the beginnings of the 3 big diseases and the appearance of symptoms. And this will help you understand why starting estrogen early, as indicated by the estrogen window, makes sense. Please schedule a consultation with me at menopausetaylor.me. I wish I could do them with every single woman. They are the best way to get the whole package all tailored to the one and only you. And I wish all women would subscribe too. You know, sometimes I get comments here asking why I don't have millions and millions of viewers. And I answer by saying that menopause is the most unpopular topic on earth. Think about it. It's the most neglected topic on the planet, even though half of the world's population spends half of their lives in the menopause. I knew this when I started the channel, that I would never have the viewership of the beauty channels. That's a shame, but it's the truth. Unfortunately, despite the fact that all women need and deserve this education, the vast majority don't want it. They are completely comfortable with their ignorance. And there's more denial of menopause than knowledge on menopause. And I'm trying to change that, even though it will probably take the rest of my life. So get as many women as you can to come here and learn this stuff. If we get enough women demanding more in the world of menopause, things will get better for all women. So come back next week and every week after that. I'll always be here, and I'm on Facebook, Twitter, and Instagram too. But you don't get an education there. Until next week, bye.